Hello, my name is Dr. Heather Johnson, and I am a preventive cardiologist with UW Health Preventive Cardiology Program. I would like to discuss with you protecting your heart from heart disease. The purpose of this talk is to raise awareness and to educate women like yourselves about heart disease, and to encourage that hopefully you will share this with other women, such as your family and your friends, and to help save lives. The topics I would like to discuss are: number one, why should women care about heart disease? What are risk factors for heart disease? I will then list 5 steps to lower your risk of heart disease. I will review the warning signs of a heart attack, and I'll provide a brief summary of these topics at the end. First of all, women are not protected from heart disease. Heart disease is the number 1 cause of death for women. About 1 in 3 women will unfortunately die of heart disease. That includes heart attacks or strokes, and unfortunately 1 woman dies every minute from heart disease. There is some good news though. 80% of heart events in women can be prevented. But we have to make healthy choices to protect our hearts. And that's what I will discuss in the next few slides. So let's talk about risk factors for heart disease. What are causes of heart disease? A major cause of heart disease is smoking. Smoking is one of the number 1 causes of heart disease, especially in younger women. Younger women may feel as though they're protected from having a heart attack, but smoking definitely raises the risk of heart disease or heart attacks in all women. Another key factor relates to cholesterol abnormalities, and there are different issues related to cholesterol. So for some people, they may have low levels of good cholesterol, also known as HDL cholesterol. Or they may have high levels of bad cholesterol, also known as LDL cholesterol. Or there may be high levels of triglycerides, also called fats that are in the blood. So all of these different cholesterol abnormalities, you may have 1 or a few, can definitely increase your risk for heart disease. Cholesterol abnormalities can cause blockages in your arteries and definitely increase your risk for heart attacks and strokes. Another risk factor for heart disease is high blood pressure. And that may mean your top number, also called the systolic blood pressure, is greater than 140 millimeters of mercury, or your diastolic blood pressure, or that bottom number, may be elevated, and that's greater than 90 millimeters of mercury. Either of these numbers being elevated means that you have high blood pressure. High blood pressure is also called hypertension. Hypertension can definitely make your heart work harder. This can lead to damage to your blood vessels, not just around your heart, but damage to blood vessels throughout your body. You may not have any symptoms related to high blood pressure, and it definitely increases your risk for heart attacks and strokes. Lowering your blood pressure definitely decreases your risk for heart disease. Other risk factors for heart disease include diabetes, being overweight, and lack of exercise. Even if you're not overweight, lack of exercise or a more sedentary lifestyle definitely increases your risk. There are risk factors that you cannot change. The ones I just mentioned before, yes, we can do something about. But age, women over the age of 55, that's a risk factor for heart disease. Another factor we cannot change is race or ethnicity. Certain minority groups have a higher risk of heart disease. And in addition, the last risk factor is a family history of early heart disease. So if your mother or sister younger than the age of 65 had heart disease, or father or brother less than the age of 55 had heart disease, that is a risk factor. However, even if you don't have a family history of heart disease, you are still at risk. So let's talk about 5 steps that'll help lower your risk of heart disease. Number 1, stop smoking. That is one of the greatest benefits that you can have on your heart and on your body, is to stop smoking. Even if you don't smoke, exposure to other people's smoke, also known as secondhand smoke, can definitely increase your risk for heart disease. Talk to your healthcare provider. You're not alone as far as trying to quit smoking. There are a lot of options available to help you quit smoking. It can be very stressful, or it may be difficult to handle stress without smoking, but that is something you can work with your provider on together. And understandably, there is a concern about gaining weight after quitting smoking. And you and your healthcare provider can work together as far as how to manage your weight after quitting. Another key step to lower your risk, in addition to stopping smoking, is to know your numbers. And I'll just review what numbers you should be aware of. The first one is your blood pressure. We talked about the top and the bottom number, or your systolic and diastolic number. It's important to have your blood pressure checked regularly by your healthcare provider. Another has to do with your cholesterol panel. Knowing what your bad cholesterol is, your good cholesterol, and your triglycerides are all very important. Those numbers will help you and your healthcare provider work together as far as what your risk may be for heart disease. Your body mass index. It incorporates your weight and your height to help determine what is a key goal weight for you, and also how to help develop an exercise plan to help you get to that goal weight. Also, have your blood glucose checked, also called your blood sugar. It helps to screen for diabetes, and if you have diabetes, it's a good way to keep track as far as how you're doing in managing diabetes. So the next step to lower your risk is to start moving, start exercising. Aerobic exercise is very beneficial. It will help strengthen your heart, improve your body's ability to use oxygen. It definitely lowers your blood pressure and helps you manage your cholesterol, and it's a good way to help lower stress levels too. Strengthening exercises are also important, so it's great to be able to find a balance between these two. There's a goal. The goal should be 30 minutes of moderate activity, at least 5 days a week. If it's difficult to squeeze in 30 minutes at a time, try 3 10-minute periods of activity. But please talk with your healthcare provider before starting an exercise program. The fourth step is to choose heart-healthy foods in order to lower your risk for heart disease. Increase your fruit and vegetable intake. Increase whole grain and fiber intake. Choose low-fat dairy products such as skim milk. And for your meat selection, fish, poultry, and lean meats are very important. Limit your alcohol. For women, no more than 1 alcohol-containing beverage per day. Limit your sodium intake. Even if you don't add salt to your foods, watch the sodium content in foods. And also portion control is very important. The fifth step is to talk and to work with your healthcare provider. You are definitely not alone in this particular process. With your healthcare provider, review your numbers regularly. Your provider will also help guide as to how frequently these values should be checked. Blood pressure, cholesterol, body mass index, and glucose. You may need to start a medication. There may need to be a medication for blood pressure, for cholesterol abnormality, for diabetes, for smoking, or to help you quit smoking. Nevertheless, start the medications with your provider and work with your provider. If there are questions about your medications or concerns, let your provider know before stopping them. Make a plan together. Definitely set up a plan as far as a quit date to stop smoking, or to develop exercises to help you get moving. Even if you have limitations such as knee pain or hip pain, you and your provider can work together with various exercise options. And also try making a food plan together to help you select heart-healthy foods. We're definitely working with you to help prevent heart disease. Unfortunately, 1 in 3 women currently do have heart events. So let's just talk about warning signs of a heart attack. Chest discomfort is still the most common warning sign for both women and men. And I say discomfort because it may not necessarily be pain. It could be pressure, squeezing, fullness, but this discomfort usually lasts more than a few minutes and it may come and go. Women more commonly may experience nausea and or vomiting, shortness of breath, dizziness, lightheadedness, back pain. In addition, there may be jaw pain or just one of these particular symptoms. There may also be pain in one or both arms, stomach discomfort, or cold sweats. If you have any of these warning signs, please call 911. So in summary, every woman should focus on lowering her risk for heart disease. 80% of heart attacks in women are preventable if we make the right choices for our hearts. Remember 5 key steps to lower your risk for heart disease. Stop smoking, know your numbers, start moving, choose heart-healthy foods, and talk with your provider. Call 911 if you have any of the warning signs of a heart attack, such as chest discomfort that will not go away after a few minutes, that continues to come and go, in addition to some of the other signs and symptoms we discussed. Congratulations. By reviewing these slides and this information, you've already taken steps towards a healthy heart. Please share this information with other women in your lives. Thank you.